Wow, we are lucky, y'all. Thank you, everybody, for showing up for today's exciting Food Democracy Lunch and Learn webinar, which we will be highlighting some work from the sponsored by the New Jersey Food Systems Research Group, part of the Food Democracy Collaborative. And I'm so happy to be here. I'm a part of the Research Working Group, and we have four amazing presenters today. And I think um, Janine, are you going to break down our overview of NJFDC?
Yep, I sure am. I'm just doing lots of different things on the back end here. But hello, everyone. My name is Janine Cava. I'm the executive director and one of the co-founders of New Jersey Food Democracy Collaborative, which is a food system education, organizing, and advocacy collaborative network across the entire state and across the whole food system. And we center the food system as a whole in our work, and try and strive to have participation from across the food supply chain and stakeholders across the all different areas of the food system in our work. And what I always say is that the working groups that we convene and manage are the heart and soul of the Food Democracy Collaborative. And so it's exciting to be able to feature the work of the different working groups throughout the year in the Food Democracy Lunch and Learns. So thank you for being here, and I'm excited to hear the presenters. Just looking quickly at the program here. So introduction of the Food Democracy Collaborative, you just heard it. And then Ricardo will give a quick overview of the research working group. And you'll hear from each of the four presenters, 15 minutes each. There'll be some time in between for very short, about 5 minutes, a little under 5 minutes of Q&A specific to each presenter. And then at the end, there'll be more time to ask questions across all the presentations. And then we'll just do an update on, or give you an update on some things coming down the pipe for FDC. Sorry, it's hard to talk and be letting people in. And so that's it for me. I'll turn it over to Ricardo for a little bit about the research working group. Just as a reminder, keep yourself muted unless you're speaking or asking a question when Ricardo asks you to ask your question. You can always put questions in the chat. And yeah, let's just have a great meeting. And thanks again for being here.
Fabulous. So I'm so excited to be helping to host today's webinar. I've been a part of the research working group for about a year and a half now. So it's a really awesome team of folks engaged in food systems research from across the state. We have representation from a lot of the major colleges and universities across the state, but we're always looking for new folks to join. So if you are new to NJFDC or not a part of any one of their working groups, the research working group is here, and we want to dig in, and we are trying to stay busy. So some of those objectives you see on the screen here: identify the research gaps, help provide or identify supporting research that aligns with NJFDC, facilitate knowledge sharing and coordination between researchers and New Jersey food systems, and provide research trainings and mentorship to students and junior researchers. We have two main projects that we've been working on. One of them has been a literature review on related research related to food systems within New Jersey. So we've been working on that for a little over a year. There's hundreds of articles we've been going through and see a lot of amazing names of researchers within the state doing great work. And another one that we're doing is more of a perspectives piece, kind of doing a little bit of background on how NJFDC aligns with food justice related matters in New Jersey. So two awesome projects, but always trying to grow and learn. And so for today's webinar, we reached out to folks trying to get a line of panelists that come from different avenues in food systems, and we are so lucky to have such great representation here. I'll do a quick overview of our speakers, but they will be presenting in the order of how you see them on our screen. So, of course, first we have Yvette that I had such a pleasure of working with Yvette on the research working group. So one of our own members is going to be sharing an awesome project. Yvette's project is titled Supporting Effective Community-Informed Food Security Screening Protocols in New Jersey Health Centers. Following Yvette, we have Leslie Canales. That I've had the pleasure of knowing Leslie when she worked at Rutgers for a bit, and she's going to be sharing some work that she was doing while a student at Rowan, titled "Fresh Approaches to Nutrition Education for Older Adults." Following Leslie, we have Dr. Serpil Guran, who is with Rutgers University, the Rutgers Eco Complex. And Dr. Guran is going to be sharing a presentation called Food Waste Reutilization, last but very important step in developing sustainable food systems. And lastly, one of my other colleagues at Rutgers, Jennifer Salt Taylor with Rutgers Cooperative Extension, is going to highlight a project called Community Engaged Research on Nutrition Security Programs, the Rutgers SNAP Project. So we have a wide representation of different types of research that we're going to be highlighting during this webinar. Thank you so much for the presenters for taking the time to share some of your work. As a reminder, we have 15 minutes to present, and we're going to do like a 4-minute quick Q&A after the presentation before we go to the next one. And then hopefully, if we have some time in the end, we could have some additional questions if there's anything we didn't cover. And during the presentations, please do put your questions in the chat box because Janine and I will be keeping track of that. And I'll be choosing one or two of those for that 4-minute Q&A after the presentation. So without any further delay, unless there's any announcements that I might have missed, I'd love to pass it on to our first speaker, Yvette, to present on Yvette's project.
Thank you, Ricardo. Okay, I think you need to, there we go. So thanks again for the opportunity to share the results and findings of this recent project. With everything going on with SNAP and with the USDA recently announcing that they are no longer collecting and reporting on food insecurity data. Unfortunately, this topic is as timely as ever. So just a quick overview of the project, and wanted to acknowledge everyone that was involved. So I'm presenting on behalf of a broad team. So in addition to me and Janine from the FDC, we work closely with our academic collaborators on this project at Rowan, Doctors Broad and Minar, as well as our two community partners, so Soph Malone and Alicia Newcomb at Crops in Atlantic City, and Katia Ramirez and Jose Spellman Lopez from Kata in Bridgeton. In addition, Kate Carnes from Rutgers Camden provided support at the proposal phase, and this study was funded by the South Jersey Institute for Population Health. So many of you may know that federally qualified health centers, or just more commonly referred to as community health centers, they play an important role in providing primary health care to patients, regardless of the patient's ability to pay or their insurance status. And as such, they play an important role in identifying various social needs of their patients and of the communities they serve, including food insecurity and connecting them to the resources that they need. And the study that I'll review is actually built off of prior work conducted by Dr. Nicole Vaughn from Rowan University, who worked with the New Jersey Department of Health and FDC. So in this prior study, a survey was administered to clinics throughout New Jersey to understand their screening practices around food insecurity. And based on the responses, it was found that many clinics screen for food insecurity, but the tools and practices varied. In addition, many of the respondents, cited various challenges and barriers for effective screening, including patient reluctance. And so that really sets up the work that we did in this current study, is trying to understand how screening protocols can be improved based on the perspectives of patients and caregivers. So that's really the crux of the current study. Our research questions you can see on the left-hand side: how do caregivers perceive and experience food insecurity screenings in the healthcare setting? and how do they respond to healthcare-based outreach. And so we met with 42 parental caregivers, primarily mothers, but also some fathers, older siblings, grandparents, guardians. And we conducted 6 focus groups. 2 were in Atlantic City, 3 were in Bridgeton, and 1 was conducted online. And the focus groups in Bridgeton were conducted in Spanish and facilitated by our partners at CATA. And so I'll just review some of the findings of these discussions that we had with these with our focus group participants. So the first part is really understanding how to improve screening in the actual healthcare visit. And so we identified some key barriers, themes that kept coming up, and the first one being a lack of trust. So people really were reluctant to answer the questions honestly because there was fear of negative repercussions, right? And so you can see a representative quote here. It's uncomfortable because when taking care of your children and you don't have food at home and someone asks if you have food or not, you quickly think of the Department of Children and Families. So you can see why someone would not want to answer these types of questions honestly. But even if they were willing to answer them truthfully, many commented about the lack of perceived value. So they felt like their physician or their child's physician or the staff that was doing the screening was really just kind of going through the motions, checking a box, and not really taking the time to connect them to the resources that they either want or need. And so you can see some example quotes there too. And so the recommendations coming out of the discussions with the participants is to really provide them with more agency and autonomy around the screening process. We had one focus group participant that said, that when they were asked these questions in a face-to-face setting, it felt very confrontational and very uncomfortable. So I think key is giving, the patient or the caregiver the ability to kind of manage this process according to, their privacy preferences. And many of the clinics do proactively screen. And if that's the case, really taking the time to explain, why these questions are being asked, what the, what will be done with the information, and importantly, what won't be done with the information and who will not have access to the information. Just to give them a little bit more peace of mind in terms of, those fears that we were talking about earlier. Moving on, we also noted that many of the, sorry, I just lost my screen here, that many of the focus group participants had a variety of preferences around screening methods. So some actually did prefer face-to-face, particularly if they had a good relationship with the physician, but maybe someone a little bit more removed from the care team, like a social worker or someone more independent. And then obviously for someone that might want a little more confidentiality, just providing them the ability to complete, the screening questions on a tablet, or through paper, either before or after the visit. And then finally, following up with tailored assistance. So really understanding what type of resources they want and need, and understanding the challenges that they face when they're attempting to, apply for different programs. So moving on to the next part, we discussed various outreach materials with the focus group participants to get some feedback on what they liked, what they didn't like. These were the materials we reviewed. Two of them, the one on the far left and right, were developed by the New Jersey Department of Health. The questionnaire in the middle is just the questions from a validated questionnaire that's commonly used for screening. And the last item was a flyer developed by FRAC and the American Academy of Pediatrics. So pretty, common sense recommendations here, but worth reiterating. Use simple, clear language and avoid jargon. So in particular, the term food insecurity was not widely understood, particularly among the Spanish-speaking participants, but even with the English language participants, they also said the same thing. Add eye-catching visuals and avoid too much text. So really kind of striking that balance between providing enough information to be helpful, but not overwhelming. And then, on different materials, add multiple ways that someone can follow up to get information, whether it's QR codes, web addresses, emails. So that was for the outreach materials. Moving on to strategies for food security outreach. So now looking beyond the actual healthcare visit, what can community health centers do to better connect their patients and the communities they serve with resources? So some high-level recommendations that we heard from our participants. Partnering with community organizations that they're already connected with and that they trust is something that we heard time and again. And these could be different types of organizations, religious institutions, sports and rec leagues, neighborhood or cultural groups, and importantly, schools. Schools tended to be a good mechanism to reach people, particularly, we were focused on caregivers, so they all had school-age children. They also like community health fairs. So, these are happening already, but just to reiterate, people did feel that these were helpful because it allows them to speak to someone directly. They can often get assistance on the spot in terms of actually like having someone walk through the application process with them. And they also mentioned that these fairs should focus on a variety of, social needs, not just food insecurity. So whether it's housing, transportation, other things that they would find helpful. And then finally, when conducting outreach, communicate in multiple ways, both offline and online. And our participants very much said that they use social media quite a bit, in particular Instagram and Facebook. So understanding, who they follow, what organizations that they're connected with online is useful to better reach the community. And then finally, this last piece, so although not directly related to our research questions around, screening, a lot of the participants talked about their experiences with different government programs. And so I think sharing this is important as well because, the objective isn't just to screen these patients, but also to connect them to the actual resources that they're needing, programs that they're eligible for. And so we wanted to just briefly go over this. So many participants commented on the application and enrollment process, particularly for SNAP. They mentioned that, when applying or recertifying, there was a feeling of being disrespected. So you can see a quote here. There are people who, instead of helping you, sometimes incriminate you. They are very rude. Sometimes they ask you many questions that they shouldn't even ask, and they respond very aggressively. And sometimes that makes people intimidated. Many people also commented on the bureaucratic process. They felt that the process was like purposely, difficult, and they had to, jump through hoops to get, to get qualified and to be enrolled in these programs that they are eligible for. That being said, there were some, positive comments on other programs, in particular, school meals and WIC. And finally, outside of food resources, many commented on the big ticket item of housing and needing more help around housing. People talked about difficulties applying for temporary rental assistance. And you can see the quote here about where they, at least for the participants that we spoke with, that they were comfortable with understanding how to, obtain food. This particular quote says, "We don't need any more help there," but it's housing. So just closing, the key takeaways are that effective food insecurity screening in the healthcare setting involves ensuring the caregivers feel safe, respected, empowered, and supported. And it's important to align healthcare screening with real-world support networks, ensuring cross-sector collaboration across the health clinics, community organizations, and government agencies. So with that, thank you for listening, and we're grateful to the caregivers who provided their input and to SJIPH.
Thank you so much, Yvette. I found this so interesting. And on the side, I was hitting up a friend because we're like, we saw similar stuff on another study. So really, really major. I don't see any questions in the chat, but we have a few minutes for some follow-up questions. So please feel free to add anything in the chat for Yvette to reflect on. And I also want to add, while folks are thinking of their questions, that Yvette is our research working group leader. So I don't know if I gave you enough credit, Yvette, but if you come and hang out with us in the research working group, you'll be chilling with me and Yvette all the time.
Yes, and just to
Since
echo what Ricardo was saying earlier, anyone is welcome to join. We're always looking for people that want to get involved.
Absolutely. While folks might be thinking of questions, if anybody wants to ask their question verbally, please feel free to either raise your hand or I don't see any questions in the chat. So you could unmute if anybody has a question to ask verbally.
Jen Taylor has a question.
So I was just gonna ask, do you have any plans to kind of do more of this or cover more of the state, or this is just kind of a one-time thing?
Yeah, unfortunately, we did apply for a subsequent grant to see if we could do other other focus groups that would cover different areas, to see if there was some consistency across the board. The other thing to add is we did this last year. And so especially with the Spanish speaking or immigrant populations, different sentiments could come up, since I feel like the environment has changed. So it would be great to do more work with this. We reviewed the study results with the Department of Health. They were enthusiastic about working together to try and communicate this out to different clinics and see what else we can do. And Janine, feel free to add anything. Janine was also very much involved in all this.
No, you definitely covered it. It was I thought, I mean, I'm clearly biased, but I thought this study was really well designed. We had a great team. The support from the South Jersey Institute for Population Health is amazing. I recommend that you sign up if you're in South Jersey or doing research in one of the 8 South Jersey counties. get on their email list for when they have additional funding opportunities. And it's always wonderful to work with Yvette.
Yes. Well, thanks, Yvette, for sharing this project. This was really exciting to hear about this work. Not exciting to hear about food security, but it's important to do this important work. And somebody did ask how you do join the research working group. So thank you, Janine, for putting that link in the chat box. And I think I could probably send that as a follow-up email as well. For our next presentation, I have such the pleasure of welcoming Leslie Canales, who used to work with me in FNET program and is sharing some of her research during her time at Rowan. I'll just read a quick bio that Leslie currently serves as a garden education coordinator at the Center for Environmental Transformation. In this role, Leslie leads the development of Eco Explorers, K through 8th garden education program. She is also a public health analyst at the South Jersey Institute for Population Health, where she supports collaborative research projects to improve health and well-being in southern New Jersey. She has worked in the areas of community nutrition, public health, and community engaged research. Her passion is empowering underappreciated communities through weight inclusive, culturally relevant, trauma informed nutrition education. And I will add that she's a rock star. So thanks so much, Leslie, for being here. And please feel free to share your screen and dive on in.
Thank you so much, Ricardo, and the New Jersey Food Democracy Collaborative for this opportunity. Very excited to present today. My presentation, as we mentioned, is titled Fresh Approaches to Nutrition Education for Older Adults. Let me get my screen set up. Okay. Trying to figure out which one to share. Okay.
Perfect. And you were just sharing it and it just went away.
Yeah.
So
Okay.
I'll give you a heads up that we can see.
Let me go back. Okay. Here we go. All right. So for this research study that I'm sharing, we are going to focus on this circled area of the food system. My focus is on nutrition education, which would ideally influence consumer behavior and diets. And that ideally would go back and impact the health outcomes of people involved in these nutrition education studies. And that can influence innovation, technology, infrastructure drivers, which are seen up here. That is the goal, to use these health outcomes to show people that we can make a difference and we can change outcomes by using nutrition education. There's a lot of ways to do nutrition education, which I'll go into the next slide. For this presentation, we're focused on older adults, but generally, nutrition education is multifaceted. It can be one-on-one counseling, group sessions. It could even be on your phone. But the focus is on behavior change techniques. So goal setting, self-monitoring, feedback, motivational interviewing. These techniques are meant to drive behavior change and help people improve the health outcomes. And they're always tailored to the individual. Everyone has different needs. We know that nutrition is essential for older adults. As people age, our nutrition needs change, and we need to tailor our programs to meet their needs. Older adults are at increased risk for chronic diseases, and there's a lot of barriers for this population to be able to meet their needs health-wise. But if we create nutrition education programs that meet their needs, that are meet them where they're at, then we can influence their health and guide them to on the right track for that. So nutrition education, like I said, can be done in different ways. This research project focused on technology and how we can advance or integrate technology into nutrition education. And with the rise of AI and technology changes, This is a very important topic just to get you all thinking about how you can add technology into your programs, or just be more aware of the resources that are out there to provide to your patients, or if you're even yourself or your community members, to share some info that they can integrate into their own life. So this research study focused on reverse mentoring and service learning. That was the main premise for this, with the addition of the technology, enhanced nutrition education. But reverse mentoring is a method or a framework that encourages young adults to work with older adults. It's used in companies. If you're training someone, you pair up with a more senior person in your company, and the goal is for the younger person and the more senior person to mentor each other in both ways, not just one direction, where the more senior person has all the knowledge. It's sharing, it's back and forth. So it promotes mutual support through knowledge sharing. And we applied this framework to our research study. The other part of it was service learning, which offers learning opportunities outside of the classroom. Both of these frameworks aren't super well studied in nutrition education. So that was the framework we decided to go with, to see if it does have an impact. If we do pair young adults with older adults, are there going to be changes in their attitudes? And I'll go into that in a second. But this is just a great way to add to the research knowledge, add to the research based on these two frameworks. So for the study, our two objectives. Sorry, my laptop's lagging. Okay. The objective first one was to capture nutrition student instructors' attitudes towards aging, and then to evaluate their desire to work with older adults in the future. We worked with 5 nutrition students, and they were dietetic students. So at Rowan University, we have a coordinated program, and in order to become a dietitian, you need to practice or be supervised for 1,000 hours. And these students were looking for service learning to get that opportunity to fulfill those hours. So we enrolled those students in this exploratory pilot study. It was an 8-week intervention. And basically, one student was paired up with an older adult, and they met each other weekly for 45 minutes to an hour. Each week, they went over a different nutrition topic based on the My Plate, which there's 5 food groups. They went over the 5 food groups. And the app that we used was called Start Simple with My Plate, which is developed by the USDA. I personally use the app throughout the research study, and even now, I think it's really helpful. It's very simple, easy to follow, but you can set goals, you can track your intake, they send you little reminders, there's even challenges that you can do. So it's adding a little gamification to nutrition education, while also it just being a very simple, easy to use app for really anybody. But that is the app that they used, and students were trained to help older adults use the app to track their intake, meet their goals, which is one of the pillars of nutrition education. If we're trying to change behavior, it's beneficial to have people track their goals and set those goals. That builds confidence, self-efficacy, and they can take that with them beyond the study. To measure, our instrument that we used was the Geriatric Attitude Scale, which is out of UCLA, and students took a pre-survey and a post-survey. They were able to get a max score of 70. And of course, to use descriptive statistics like mean, standard deviation, percentages, frequencies. And then finally, we did a paired sample t-test to examine the changes in their scores. And then we'll get into the results. So, like I mentioned, this is a small pilot study. We had 5 students enroll for this portion of the study. and most of them were seniors in the nutrition program and female. They were between the ages of 20 and 28. So as I mentioned, we did a pre and a post survey. This figure here shows you their plan, if they're planning to work with older adults after the study. So at the beginning, 3 of them said they were interested in working with older adults. 2 of them were no. And then after the study, we had the same 3. They said yes, they want to continue. And then the 2 no's became a maybe, which is good to hear. We'll talk about what that actually means in the research. But just to me, that was the most enlightening part of the study, to know that even in just 8 weeks, we offering people the opportunity to connect with each other and interact with each other on a more frequent basis, there is the potential to change their attitudes, even if it's just from a no to a maybe. I think that's a great step. Again, for the researchers in here, it's probably like, well, then we have to look at more studies and the stats and stuff. But as you know, just briefly looking at it, yes, we did have 2 people go from no to a maybe. We also asked some open-ended questions. This is the post responses to the question, has your perception of older adults and aging changed after volunteering? If so, how? So the same colors that correspond. The blue is for yes, people that do want to work with older adults, and the green were the maybes after the study. So our 2 people that said maybe, they said yes, I view older adults in a more positive light. And then the other participant said, I think that not all older adults are the same, and it depends on their personality and the situation that they're in. So even just building that understanding of empathy, of basic empathy towards each other, and understanding each other, of like, we all come from different situations, not everybody's the same. I think this is a great study to at least expose students to working with different populations, and it's very relevant to nutrition students who are going to have to work with a variety of populations in their education and even beyond, just interacting with different age groups, just to build that opportunity to be exposed to different people and have the chance to speak with them and interact with them is beneficial. So this is the nitty-gritty of our research study, where we looked at the changes in the scores. Like I said, we measured their attitudes. 3 of them did increase their scores, and then 1 stayed the same and 1 dropped. So after reviewing and doing some analyses, we found that there was no significant change in their scores. But again, this was a pilot study. It was short. We had 5 students, and the sample that we had a generally positive attitude towards aging at the beginning. So from here, we've done, I know that the team at Rowan has done a lot of further research on this study, and it's gone in a few different ways. So we're still working on offering tech-enhanced nutrition education to older adults. And this is an area that's not very well studied, so it was a good starting point to at least provide some preliminary evidence for the potential of service learning and reverse mentoring, just to see people build a little more empathy, have the opportunity to interact with people, is great. And then finally, my recommendations. So the connecting food systems to nutrition education is all about the person who's involved in this study. If we want to create and empower people to be involved and to take an active role in their health, we need to be able to provide them competence and opportunities to build competence, relatedness, autonomy, to understand their role in the food system and activate that agency. In order to do that, they are going to need the tools to be able to do this and to make these changes, which brings me to broadband access. We've been talking about technology, and It's a mobile app that we used. Can't access it without the internet. So I'm a person that likes to advocate for things and supporting people to be able to access the tools that they need to make these health changes. And if people don't have access to the internet, they're not able to access the resources that they need. And this is a big issue in New Jersey. Older adults make up 18% of the population. I believe that was the last number I looked at. It's a big portion of the population, and a lot of them do not have access to the internet. I know there are studies currently going on, funded by the South Jersey Institute for Population Health, to look at broadband access and to be able to measure it. What do people actually have access to? And once we have these numbers and this data to back up the importance of having access to the internet, we can give people these tools to be able to use these apps, use AI to be trained on how to use them, and then influence their own health outcomes, which again will then drive innovation, technology, and just make a better infrastructure for everybody. So broadband access is very important, and also tailoring nutrition education to the population that you're working with. Is just an important reminder to be iterative with your research projects and take a look at who you're trying to reach and how to best reach them. For us, it was using technology, working with students who wanted to have the experience, and older adults who were seeking that experience. That was helpful as well. My last point, my last recommendation, to keep offering opportunities for connection and collaboration across the age groups. This research is relevant for a lot of different people, whether you're in higher education and you're working with nutrition students. I saw the value, not just working with students myself and seeing their responses to having these one-on-one interactions with people, but even the professors who are like, okay, I can, give my students this opportunity to practice what they're learning in the classroom in the real world, to, practice those theories. And motivational interviewing is really valuable for policymakers. If you're looking to enact policies that will ensure people have access to the internet, affordable access to the internet is also important. That could be an opportunity for you to realize, yes, the internet is helpful. If people are afforded the opportunity to access it, it can impact people in a positive way. And then even just for healthcare professionals, maybe there's someone here on the call who are working with patients one-on-one. The app that we used is a very simple app. It's free. Some of the resources are available in Spanish. So you could even offer this app as a tool for your patients to use when you're not interacting with them. They have, trainings on the myplate.gov website that show you how to use the app. And this is a tool that patients can use on their own to, activate that agency, build confidence in themselves, and be able to track their goals, which we know is important for nutrition education. Cardo, I think that's all I have. And I know I talked too much,
Yay!
so I'm sorry if I went too short.
We are good here. Fabulous job, Leslie. Thank you so much. This is such an important topic because I think in a lot of fields we're discussing the lack of individuals trained to work with older adults in healthy aging. I was at a conference last month where they said there's not a lot of geriatricians anymore. There's not a lot of folks trained to work with older adults in healthy aging. And we have a lot. It's a growing population. So thank you, Leslie. We have a few minutes for just like a few brief minutes for questions, and you have a few in the chat, Leslie. So I'm going to throw them at you, okay? One of them says, where did the interactions with the adults take place?
So this was at a healthcare office in Sewell. It was at RCSJ. There was an office there where we recruited through medical offices and patients that were already being seen.
And they would so the students would meet the adults at that facility?
Yep.
Okay, great. And did the students working with adults give you any feedback on the willingness of the older adults to engage with technology?
They did, yes. The older adults, they gave their own feedback on what they liked about the app, and generally the feedback was positive. They said it was easy to use, and they appreciated having someone to guide them in using the app. You know, whenever you're using something new, it's nice to have someone to troubleshoot it with, and that was why the students were there to help them work through these challenges. So they were appreciative of the student and of the app itself.
I love that app too. Was there
Mhm.
any hesitancy from the older adults about using technology?
Not in our sample. Our
Okay.
sample was, yeah, they were fairly open to technology, and I think that may have helped as well.
Nice. And do you have any thoughts of expanding this to observe those behaviors for different age groups? Like I know sometimes like folks try to avoid teens. So this question's about, was there any focus on the youth or teens or adults or older adults?
So this project was focused on older adults. We didn't interact too much or recruit for teens. But that's a great idea to see if they're always on their phones. It's great to, give them an app that would help them reach their goals. But yes, the older adult was our focus.
Nice. Well, that was a really exciting presentation. Thank you, Leslie.
Thank you
Um,
so much.
Yeah, and folks could feel free if there's any other questions that pop up, you could put that in the chat. And if we can't get to it during the webinar, we will see if we can follow up with Leslie to kind of share any additional insight. For our next speaker, I'm so excited to pass it off to Dr. Serpil Guran, who is a fellow faculty member at Rutgers. She's in the Department of Agriculture, Food, and Resource Economics. She also has been serving as the director of Rutgers Eco-Complex Clean Energy Innovation Center and Business Incubator since 2011. Her teaching and research topics include sustainability, reutilizing components of waste within circular economy framework, climate change mitigation, and low carbon fuels. Her current research especially focuses on food waste reutilization. And I am so excited to hear this presentation. I had the pleasure of observing one of these presentations a few years ago. So I can't wait to hear about this recent project. Thank you so much again for joining us.
Thank you, Ricardo. Thank you for this wonderful introduction. And also thanks to New Jersey Food Democracy Collaborative for this webinar and opportunity to share my research. And good afternoon, everyone, again. Yes, the title is mouthful, as you can see, food waste reutilization. But since we are discussing food democracy, sustainable food systems is essential. Understanding sustainable food systems is essential for food democracy and provide all citizens the right to food, actually. And so I will be touching this. And then I will put in a context that food waste recycling, obviously reduction, food waste generation, should be reduced, definitely. But then there is a certain part of food waste that you cannot, it's unavoidable, and we have to reutilize it, and within the circular economy, context. Yes, you can see that we are getting crowded. Everybody talks about that. If not 12 billion, we're going to be around 9 to 10 billion by 2050. That means that we will need, more resources. I'm just starting my timer, but anyway, so you're running the timer anyway, Ricardo. So we will need materials for, shelter, transportation, healthcare, communication, everything, but we will need more food for sure. And so we have to ask whether or not world can, sustain, can provide for the increased population the food that we are consuming today and what's going to happen tomorrow. Yep, farmers, they have to produce, we said this, at least, 70, 60% need, resource need for food, will appear. That means that farmers need to produce more food per unit of land, right? And facing environmental problems such as climate change, economic volatility, geopolitical problems that trade deficit, shifting diets and nutrition need. So these are, these will impact food systems locally, regionally, and globally. So it's an important problem that we really have to understand. And let's glance back the developments since World War II. We transitioned from animal and machine animal to machine power for agricultural activities. And we started using also chemical fertilizer, agrochemicals, synthetic pesticides. Additionally, single cropping has become an appealing application, but obviously this kind of applications or practices came with the costs: topsoil depletion, groundwater contamination, family farming, disappearing, the family farming, and this obviously the most important also disintegration of economic and social conditions of rural communities. And we have to ask ourselves, is this sustainable really? And when we are talking about food democracy, well, I'm sure this is not the first time you're hearing that high levels of wasted food we are facing. At least 30 to 40% food does not reach to our tables. And also rich countries are wasting, research states that, and research countries are wasting the same amount of food that sub-Saharan countries are consuming, that amount of food. So it's huge. First time we have as many obese people as undernourished people around the world, and our habits, dietary habits, are in a very bad trajectory. And so obviously, current trends also, like industrial livestock and crop production operations, and time to time appearing interest for biofuels, especially first generation biofuels we're talking about, like food to fuel pathway biofuels. They are likely to cause more problems. And obviously, we always say this, a lot of volatilities. You can see this New Jersey food insecurity, and I won't be going through in detail, but you can see that, overall New Jersey food insecurity also is sort of increasing. And so we have to pay attention. So food insecurity is very much related with what we are talking about, wasting food. And also, we said this, we are producing a lot of food, but the main debate is, do we need just more production? Food is critical in the whole understanding of sustainability, but the debate is not just about food. And so we have to have innovative, regenerative, and restorative agri-food systems. And they have, those systems should be environmental friendly, socially acceptable, but obviously, definitely economically feasible, so that we can provide everyone the right to food. And what is right to food? And so it's basically the food should be healthy, right? Nutritious, safe, adequate amount, affordable and available. And also another important matter is should be culturally acceptable. So, we have to look into food, and, when we are wasting the food, and we have to think not twice, we have to think many, many times. And so we are pushing for trying to, our research is sustainable, developing agri-food systems, and also regenerative agriculture and circular economy, and achieving the whole sustainable agri-food systems that it's important for economy, security, resilience, and also health of the, we need healthy populations, right? Obviously, our food system is vulnerable to climate change, you name it. And so degrading soil quality, availability of water, and unsustainable crops and invasive crops, weeds and pests harm to produce. And also, I keep talking about food waste. And so let's take a look at the estimated food loss across US food supply chain. look at, the blue is, the industry. So basically processing, food processing. And then the retails, component and also consumers. Usually vegetables, fruits and meat. So you can see that how production is wasting a certain amount of food. But then consumers always, look at this gray bar everywhere. It's pretty high from every part of vegetables, fruits, grain. And also retail has its own share for wasting food. So nobody is innocent in this picture. When we waste the food also, you can see that environmental footprint of food supply chain. You can see how, agriculture, utilization of fertilizer, pesticides, water, energy, how much, is, input for the environmental problems of food supply chain. So this is very, very important when we are taking, when the holidays are approaching, taking a slice of pie into our plate, we have to think twice whether or not are we going to finish everything or not. And because planetary boundaries are finite, and so basically a very recently published report is saying this 7 out of 9 boundaries have already been transgressed. What that means that world to stay stable and resilient, we need these planetary boundaries, but we already transgressed the 7 of them. The food we eat also is not so innocent, as you know, and the 5 planetary boundaries are, impacting the global emissions. We all are responsible. Only less than 1% of the people, only 1%, currently live in countries where food needs are met without breaching these planetary boundaries. This is very alarming, really, that we have to think twice, 3 times, as I say, many times. I'm not going to, read the, but maybe I should read it, and how current linear food systems is basically produce, consume, and throw it away systems, as causing also economic loss. And it's about $5 trillion annually. And so I mentioned you that, everybody knows what food waste is, but let's divide food waste into several sections. There is avoidable food waste. There is possibly avoidable, and also there is also unavoidable food waste. Avoidable food waste is, I mentioned you, if we don't finish the slice of bread that we try to start eating, or apples, we don't like the appearance of the apple, or meat, this is avoidable food waste, that if we, at the beginning, we don't waste it. It's basically post-consumer food waste. And possibly avoidable, certain people started utilizing potato skins, right? Or even orange peels are now, going into jams and everything. And so some people eat, some people prefer not to consume, but possibly avoidable food waste. And also this includes also a little bit food processing. And also there is also unavoidable food waste arising from food and drink preparation, and has not been edible under normal circumstances, like meat bones, eggshells, pineapple skins, tea bags. So these are unavoidable food waste, but there is food involved with that. They are all biomass, and we have to reutilize them. We have to send them back into the economy. What we're doing currently, if you have listened my presentations over the years, I'm sure you're familiar, but I always use this simple depiction, because from farm to your table, let's look into apples. And every step, and then apples after picking, they go to food processing. Let's say food, pie making, pie baking, and then transportation, and then either apples come as apples or pies for retail and your table. So every step, everybody is using fossil fuel, right? And every step, there is organic waste. And then what we do is we collect that food waste and send it to landfills or incineration. What do they do in landfills? This is not a big environmental seminar, but landfills are not recovering the landfill gas fully, and at least 15 to 20% research states it's leaking into the atmosphere in the methane form. And so this is the linear application. But how about a concept of circularity? And how about we should see this unavoidable food waste as resource? We should not even call it food waste. We have to find a new, better word. And so circular economy has been around for last 10 years, 15 years. And it's an economic system that replaces the traditional end of life concept with reducing, reusing, upcycling, or at least recycling, recovering the materials in production and distribution, and consumption stages. Basically, waste, should not be defined as waste. So in this case, the linear food systems can be applied to closing the loop kind of approach. Let's take a look. Just take a carrot and it becomes carrot soup, distributed. But then whatever the waste along the way is generated should be recycled, reutilized. In this case, you can generate compost, or if you're doing anaerobic digestion, you can generate power, you can feed into the grid. So in this case, it's basically, and then digestate or compost is fed back into the agricultural soil improvement. So there you go, you're closing the loop. Just food waste reutilization can help us mitigate climate change, and so can support. I'm sure everybody knows there are so many different components and requirements for climate change mitigation, but this part also is very important. Types of organic waste. Yes, we're talking about food waste, but types of organic waste, farm waste, food waste, and certain parts of wastewater, and also grass clippings. Everything should be reutilized. I mentioned you about composting. I mentioned you about anaerobic digestion, but we're talking about slaughterhouse, the bones and everything. So there are also emerging technologies, thermochemical conversion technologies and other biochemical and chemical conversion technologies. I won't be teaching you what pyrolysis, gasification is, but it is important. There are emerging technologies. The most important part is we have to prepare the markets. When we are introducing any new approach, any innovative approach, we have to push with the technologies. But also we need markets to pull with policies, and that I will be talking, in a few minutes. And so we have to take this into the new concept of food, energy, water, and also waste nexus, because in this case, because food is energy, we're talking about carbon footprint. Energy has water footprint. Water has energy footprint, and so in this case, but if we look into food has energy and water footprint. So why don't we create a new nexus that integrating waste into this nexus of food, energy, water nexus. So creating a new nexus to closing the loop, basically. And so I talked about many different, different things. The all-important part is several concepts, one unique goal. Yep, we have to achieve regenerative agriculture, and to achieve soil health, right, and protecting biodiversity and resilient farming. I am talking about circular bioeconomy. Yep, nothing should end up neither landfills or incinerators. We're talking about unavoidable food waste should go back into the bioeconomy and for reutilization of waste. And so creating circular agri-food systems, and that should be also sustainable, so that in this case we can create a efficient food systems, and and also providing humans right to food. That I mentioned you that everyone should have an access to affordable, available, nutritious, healthy, and safe food. And sustainable agri-food systems, that I am saying, this is my research, and they should not overuse synthetic fertilizer, pesticides, should not practice intensive farming. Should not cause deforestation, should not create emissions from fossil fuel. We have to displace as much as possible fossil fuel use. And it should not cause extensive water consumption and contamination, and it should not result biodiversity and erosion. And so I'm just going to talk quickly about what's happening at Rutgers also. Some of you, I'm
Perfect.
sure,
Just to give you a
heard
heads
the news.
up, we have
Yes,
a 1 minute, 1 minute
Yes, I
summary.
am finishing in this case. What we're creating at Rutgers, I am going very fast. So we have a living laboratory example of a composter, and we are one cafeteria's food waste is being composted in an innovative way. It's in the in-vessel aerated composter, but we are also working on next steps is anaerobic digestion. So we are in the planning stage for anaerobic digestion, for feeding the food waste and creating renewable natural gas to displace fracked natural gas as much as possible, but also creating biofertilizer. It's going to help reducing our carbon footprint. So quickly, we need short-term planning. I won't be reading this, but engaging every level of decision makers, but also all consumers, all students, everyone. And also we need to plan for mid and long-term planning. It's not for Rutgers, also everywhere, New Jersey. So everyone should plan, because what we need in New Jersey, we created in Rutgers a micro infrastructure, collecting the food waste from a cafeteria, moving to composter. So it's a micro infrastructure. We have to create this kind of efficient infrastructure in New Jersey. And the New Jersey food waste reutilization industry is emerging. And so decision makers, should consider that everything should be not creating additional traffic, not creating odor, noise. So we have to consider those. So key paths of action: organize small, medium farming, and for defining goals. Innovation of new and also new technologies we need. Obviously, we have to reduce waste creation, but I'm talking about unavoidable food waste. And so avoid using productive fertile land for biofuels. Biofuels, if we are to produce biofuels, it should be second and third generation biofuels, like organic waste to biofuels, or like algae or duckweed to biofuels should be, practiced. Utilize intelligent and transparent measurement results. Life cycle analysis is very important, and also motivate and reward investments. And so thank you for your attention. And with this, I am stopping to share also.
Thank you so much for going over this. And I really appreciate you making sure to link that right to food and that democracy aspect.
Yep.
And I also want to make sure to highlight for our audience that you have been a leader in this work and in this state doing this for a while. So I really appreciate you painting that big picture for us. There were a few questions in the chat, but I think we might have been able to add some comments to that. So what I'm going to do is I'm going to jump to Jen. But if there's any questions that we might have missed, I'm going to make sure to follow up after this webinar, okay?
Yeah, I have a question
but
for Dr. Guran. Hopefully we have time after Jen
Yes,
Taylor's
please.
presentation about a food waste policy in New Jersey and what Rutgers might be doing to help try to support DEP and lawmakers and becoming more progressive on some of those. So hopefully we have time for that later. Thanks, Dr. Guran.
Yeah, thank you. And just quickly, New Jersey has a one council that trying to create recommendations, but the work is still ongoing, I should say, over there, but we can speak offline. Yeah.
Fabulous. And this is a complex, big picture item. So, you know, a lot of our work may cross over in this area. So it's with so much pleasure that our final, last but not least speaker today is Jennifer Salt Taylor, who's a registered dietitian nutritionist that with Rutgers Cooperative Extension. She's in my department, Department of Family and Community Health Sciences, in our Passaic County office. And she's also a certified health education specialist focused on nutrition security and food systems. So, Jennifer, I'm not going to delay at all. I'm going to pass this right to you. Take over. Thank you so much for joining us.
All right, awesome. Thank you all for having me. So like we're